New details emerging today about a major glitch in President Obama's health care overhaul. According to a report just out, roughly 3 million middle-class Americans under the new law can now receive Medicaid. That's basically free health coverage meant for low-income families. Critics now warn this could further bust state budgets nationwide. Wyoming Senator John Barrasso is a Republican. Senator Barrasso is also an orthopedic surgeon. Welcome to America Live.
Thanks for having me.
So explain how this could happen. So basically it sounds as if the architects of the new health care reform law didn't realize that 3 million middle-class Americans will now qualify somehow for Medicaid that was designed just for poor people.
Well, Nancy Pelosi said it. First you have to pass it before you get to find out what's in it. But Alisyn, week after week, we are finding out something more about this terrible health care law, and that's why we have to repeal the whole thing. This part about putting 3 million middle-class Americans on Medicaid, a program designed for low-income people, who's going to pay for it? Well, the rest of us, the taxpayers of this country, are going to get stuck with the bill, and Forbes feels it may be $450 billion over 10 years. It's very expensive, but it just shows how irresponsible the Democrats were, forcing a large bill through Congress where members of their own side didn't read it, didn't know what was in it. The president said, oh, we got to sign it. This is going to be great. This health care law is bad for patients. It's bad for providers, the doctors and nurses taking care of them, and it's terrible for taxpayers.
The Assistant Secretary for Public Affairs came out with a release, an article in which he says, we've basically just discovered this, and we are now going to work on a fix. Is this fixable?
They need to repeal the entire health care law. Need to repeal this part, but repeal the whole law. They keep talking about trying to fix this. This past week, they came out with another 100,000 waivers. There's now over 3.2 million Americans who receive waivers from the health care law. A lot of them are union members who lobbied for the health care law. Alisyn, this is not fixable. This health care law and this administration have inherited a problem, and they have made it worse. And as
you know, they say that in terms of the waivers, they will stop the waiver program as of September because obviously there's been so much controversy about that. But here's what the supporters of the health care reform say, is that part of the reason they did it was because they wanted to give consumers more of a competitive edge, and that through these exchanges, consumers will be able to shop around for the most affordable or best health care program that suits their needs. Is that not a valid point?
Well, they've set the bar so high that consumers are only allowed to choose between expensive plans, and for a lot of people that's not what they want. They don't need government-approved health insurance. There are a lot of ways we could do this more inexpensively. The president promised a couple things. He said if you like what you have, you can keep it. We now know that that promise has been broken, and he said it would actually lower the cost of health care. And people are seeing the cost of health care and their health insurance, Alisyn, go up higher and faster than if the law hadn't ever been passed in the first place. We need to repeal the law.
And yet, obviously, health care costs already were spiraling upwards. You're a doctor. What is the one thing that you believe we should do to fix health care in this country?
Well, I think more patient responsibility, more involvement. I think that if we have a way that there's more skin in the game where people are making decisions, spending their own dollars. As a surgeon, I saw this where people, when it's their own money involved, they are very good shoppers. When they're spending somebody else's money, they don't focus on it as much. That's one of the ways to get down health care costs. The other is let people buy health insurance across state lines, deal with all the lawsuit abuse that's out there in the defensive medicine, and give people individual incentives to stay healthy. That will help drive down the cost of health care, Alisyn.
Well, those are three great suggestions. I just asked for one, but I got bonus answers. Senator John Barrasso, thanks so much for coming with your expertise.
Thanks for having me.